Hi, I'm Sarah Burns. I want to welcome you here today and thank you for taking time to consider this 90-day program on alternative healing for men's health and erectile dysfunction. You may be asking yourself, what made me decide to incorporate a program on ED within my energetic healing practice and energetic classes? In a sense, this program found me. Several things occurred that made me place focus on this issue, but the most significant reason was a number of younger men coming into my office seeking help for their stress after being placed on medications for hypertension. Through the interviewing process, it became clear that these medications were causing ED. What was surprising was the age of many of these men, and what was not so surprising was the shame and embarrassment they felt by having this problem come on. Looking at ED holistically and then further exploring Western medical treatments, I could see a vicious cycle of experiencing ED, the underlying feeling of shame and embarrassment ED caused, the potential of further increasing ED symptoms because of the shame, and other health issues that most likely leads to more medications that begin to create symptoms of depression and even more stress. These symptoms would most likely lead you further to prescriptions of antidepressants, which many would not allow you to achieve full orgasm, leading you only to, of course, experience more frustration and so on. This is common in our culture and oftentimes not necessary. Coming from a nursing and social work background, I understood that my clients experiencing ED and stress had many underlying issues surrounding the cycle of obstacles that needed to be addressed. Utilizing my skills as a life coach, I wanted to begin helping my clients by first exploring and understanding myself what Western medicine actually did have to offer. What I found, to my surprise, was that none of the standard treatments of ED promised a cure. I know that may sound shocking, seeing the beautiful ad campaigns on television for ED medication and all the claims science has made on the advancements in medicine, but it's true. There are no standard treatments for ED that ends with a cure. So let me begin by sharing with you what I found out about the more common treatments of ED that Western medicine currently offers. Viagra, Levitra, and Cialis all work by blocking an enzyme called phosphodiesterase, also known as PDE5. PDE5 promotes increasing blood flow to the penis. While it's effective in about 7 out of 10 men who use it, many men can't use it if they're taking certain medications for hypertension, and over time these meds lose their effectiveness. They also carry some common uncomfortable side effects, including headaches, upset stomach, bluish and/or blurred vision, sensitivity to light, back pain, and muscle aches. Although they report these as rare side effects, sudden vision and hearing loss can occur. Is it worth the risk of finding out if you are the one who experiences one of these effects? Also, when you learn about alternative healing through our 90-day program, you will discover that these side effects are clues that these medications actually contribute to ED in the long run. If you read the list of side effects, you will find they report that these meds do not cure ED, do not increase sexual desire, and again, they lose their effectiveness over time. The FDA suggested that each of these meds be priced at $20 per tablet, and if you're buying them for less online, you may not actually be getting these meds based on these regulatory suggested guidelines. Hormone replacement therapy is another Western medical treatment. Inadequate testosterone is not a common cause for ED, but it's increasingly being promoted as a regimen for managing ED. HRT advocates claims its importance for maintaining muscle bulk, adequate levels of red blood cells, bone growth, a sense of well-being, and sexual function. But unlike menopause in women, which represents a well-defined period in which hormone production stops completely, testosterone's decline in men is a slower process. The testes, unlike the ovaries, do not run out of the substance it needs to make testosterone. A healthy male may be able to make sperm well into their 80s or even longer. However, as a result of disease, subtle changes in the functions of the testes may occur as early as 45 to 50 years of age, and more dramatically after the age of 70 in some men. Because of the marketing trends, another area of concern is the adverse reaction of too much testosterone causing increased aggression. This, of course, is an obvious issue that can lead to an inadequate sex life with the partner. Medically administered testosterone shots or patches help some men, but no specific level of hormone guarantees potency. Men with prostate cancer and/or breast cancer are not candidates for testosterone replacement therapy. This form of therapy is pricey and would require you to be on it for the rest of your life. In checking with the local HRD doctors here, the lab work before even going into the office begins around $600. And the initial visit with the doctor ranges from $395 to $495 here in San Diego. Follow-up visits are around $275. This does not include getting the hormones, which again does not cure ED. And again, this is a lifelong program you would need to commit to. In our program, we too recommend lab work. However, we are seeking to reverse your physical conditions which are causing ED. Our purpose for offering this is to ensure that you're not wasting your money on unnecessary supplements that will only discourage you from believing ED is reversible. In creating this program, we've been conscious of cost for you and will offer the best pricing regarding your health conditions. This program is also designed to educate you so that you can manage your own health, ultimately for free. We see the importance of starting this program with adequate supplementation that is specific to your needs. But again, we do not promote supplements and herb as a lifelong necessity, as you will find in hormone replacement therapy. Another medical device is the vacuum pump. Overall, I think this device speaks for itself. Looking at this device looks more like a medical procedure rather than a device that's going to lead to love, passionate sex, and romance. The device gives the impression of being sick and helpless. And pumps are not known for creating strong erections either. Its purpose is, again, to increase temporary blood flow, and they can cause bruising and numbness. But the biggest problem with this device is that it ultimately weakens the muscle around the penis because you're compensating with a device instead of building and relying on self-sustaining strength. Our 90-day program will teach you techniques that are aimed to build penis strength and endurance. Other therapies include transurethral therapies such as Muse, which works by relaxing muscles in the surrounding blood vessels of the penis in order to increase temporary blood flow. Again, relaxing muscles seems to be counterintuitive to resolving ED. These therapies are less successful than injection therapies, which we'll talk about in a moment. They can also cause urethral burning and bleeding. Another similar treatment is penile injections. Another medical group here locally in San Diego advertises treatment for ED, with this being their primary focus. The cost range is $300 for 5 injections. They claim that it's pain-free, but studies have shown otherwise. And many men decide against this treatment early on because of their experience with pain. Again, this is not a cure. In our program, we do not believe that your ability to experience sexual satisfaction should equate to pain, trauma, or any health adversity. We believe internal peace and a body without pain promotes sexual vibrancy, strength, and longevity. Finally, surgical implants. I know that these slides are very graphic and they speak for themselves. I know many urologists are ethical and would not promote surgery right away, but being a doctor is being in business, and their biggest moneymaker is surgery, and penile implants is a big moneymaker for surgeons. So in considering that concept, you can see why Western medicine has not found a cure for ED. I know these slides again are graphic and uncomfortable, but I would like for you to ask yourself this question. Is your life and relationships important enough for you to invest in yourself by taking the time to explore your health in depth and perhaps learning how to overcome old habits? Is a surgical implant really the way to go? If ED could be treated alternatively. I know that you might come up with other medical options that weren't addressed, but overall the Western medical model for treating ED is based on temporarily creating optimal blood flow to the penis area. From both alternative and Western perspectives, ED is viewed as an early warning sign for other health conditions. So in considering the approach of the ready fix for establishing temporary blood flow, we can see that this does not create an opportunity to actually do a thorough investigation to see how you can return to optimal health without the use of devices or medications. So how can you create overall optimal health along with reestablishing potency? First, you need to consider ED as an early warning sign, or a better way of saying this, a wake-up call. Not just from a physical perspective, but from an emotional and spiritual perspective as well. In doing energy healing, I recognize and honor that issues such as ED are ways in which your body is calling on you to pay attention. Part of that work goes into looking within to see what your ED looks like to you internally. Have you ever just closed your eyes and gone within to ask yourself what you think is causing ED? And what does ED look like inside your own body? This is a good starting point of really taking the time to be honest with yourself and honor what you're thinking. And this is the second step in conquering ED. There may be issues that you may not have had time to even consider that may be challenging you in your health, such as ongoing stress from work as well as your home life. You may not be getting the right nutrition, even if you think you are. It may be a simple yet difficult message that your body is aging and cannot endure the type of hardships you once placed on yourself, such as a partying hard lifestyle that many of us were able to do in our teens, 20s, and early 30s. And another consideration that rarely gets looked at is the energetic exchange between you and your partner or other people you may be close to. This is why I established this program, so that we can explore all the possibilities of what might be contributing to your overall health and learning new ways and techniques to help you manage them from taking over your life as well as your health.